Really quiet. So I guess we'll get started. Hi everybody, I'm Jennifer Player. I'm the President and CEO of Habitat for Humanity here in Orange County. Can everybody hear me okay? Yeah? So welcome to the first installment of our Home is the Key speaker series. I wanted to briefly tell you about how this speaker series came about. And it started percolating for me a couple years ago. I was at a conference in Atlanta, a Habitat International conference, and I heard a presentation from Boston Consulting Group on key, sort of the top 10 initiatives that donors were funding throughout the country. And housing was listed as number 9 on the list. And at the time I was serving as the Director of Development for Habitat, and I was really surprised by the fact that housing was number 9, and when I looked at 1 through 8, they were very important initiatives on healthcare and food insecurity and homelessness, education, but it felt like we were looking at this list in silos, that we're either supporting one or the other. And so I became really curious about this intersectionality between housing and all of these other outcomes, and how it felt like we don't talk about that enough. We talk, at least at Habitat, we talk a lot about our outcomes in housing, but I felt like we weren't as connected maybe as we could be. And then last year we had the Keenan Flagler Business School students who said they were interested in helping with a project, and this felt like the perfect thing that could help make this idea come to life. And so shout out to our 3 Keenan Flagler Business School students here who have helped put together the series. Let's give them a round of applause. And I have learned a lot already in talking to some of our speakers, so I'm hopeful that this will be just the start of a conversation as we look at how home really can be and is the key to improved health outcomes, to improved education outcomes, and to improved opportunity for people to be able to advance in their own life in whatever way that is. So we do have a flyer there. It has bios on one side. On the other side, it has information about the other 2 panel discussions. They'll be the first Wednesday of October and November. The other 2 topics are education in October, and then November we'll be talking about economic mobility, both for individuals, but also economic benefits for the community with affordable housing. So we hope you'll join us in continuing these conversations. And I also want to say thanks to our sponsor. UNC Healthcare has allowed us to be here tonight in this beautiful space and have some wine and food as we have this important conversation. UNC Healthcare knows a little bit about housing and healthcare. They have sponsored a number of houses with Habitat. One of our speakers tonight is with UNC Healthcare. So we know this is something that they're constantly working and thinking on. And so we're excited to have UNC Healthcare with us. And I want to invite up Dr. Ian Buchanan, who is with UNC Healthcare.
I don't like microphones. It's a small room. I never worry about being heard. Thanks, everybody. I'm Ian Buchanan, Senior Vice President of Operations on behalf of UNC Healthcare. I want to thank everybody for coming. We're very proud to be sponsors of this session tonight, and we're very proud to be sponsors of Habitat and also be part of the Orange County community, obviously, for a long time. Anybody who doesn't think that access to adequate housing and substandard housing are major public health issues has never taken care of a patient in North Carolina. And the fact is, for all of the wonderful doctors, wonderful nurses and staff that we have at UNC, and for all of the really fancy technology we have, to be honest, there's very few medical innovations and medical interventions that we have with our patients that can make as much long-term difference in someone's health and well-being as having a house that's warm in the winter and cool in the summer and safe and not full of pollutants. And so we see it every day, unfortunately. We see people come in whose illnesses are directly related to their housing. We see patients very frequently who are ready to leave the hospital, but they can't leave the hospital because we have nowhere safe to which they can go. We can't send them back to the substandard housing that they've been living in. And so it's something that is very front of mind for all of us, and certainly for folks like Ceila Loughlin, who take care of these patients every single day. And unfortunately, it's also something that we have to think about in terms of our workforce. Hospitals, health systems are unusual entities in that we have some of the highest paid folks in the workforce, and our physicians and those type of folks. And we have some of the lowest paid, a lot of the lowest paid folks in the workforce, our housekeepers, our food service staff. And so that's part of the reason why it's so important to us to sponsor Habitat and to try and ensure access to quality housing for everyone, because we feel it both from our patients that we serve and also from the staff members that we're proud to have on part of our team. So thanks to everybody for coming out tonight. We appreciate everybody being here.
Thank you, Ian. Thanks for being here. Sneak peek, Ian will be serving on our economic mobility panel as we discuss more about what it means to be a major employer in Orange County and the challenges of affordable housing as a major business and employer in the county. So let's get this conversation started. I'm going to invite up a friend and a Habitat board member who's going to serve as our moderator, Joy Steinberg. Joy is the founder of JSI Marketing, which is a marketing company based here in Chapel Hill. But perhaps most importantly to this group, serves on the Habitat board and has traveled with Habitat at least to Honduras and Cambodia, in addition to other service trips, which is a big passion of Joy. So tonight she's serving as our moderator, so please welcome Joy Steinberg.
I'm going to follow Ian. Are you able to hear me okay without the microphone? Yay. So we'll keep this here. And I would like to welcome our two panelists. If you wouldn't mind joining, first we've got Dr. Ceila Loughlin and Kirshnavenia. I'm going to give it my best try. Balakrishnan. Yay. If you wouldn't mind, ladies, taking a seat. And if you would please just share a little bit more about your role in our community and what your key focus areas are in your day-to-day work as it relates to our topic today.
Can you all hear me okay without the mic?
Yep.
We're not going to use it. So my name is Kirshnavenia Balakrishnan. I work with Orange County Health Department as the Healthy Communities, Healthy Homes Coordinator. My background is in public health. I received my bachelor's in science from Human Development and Family Studies from the University of North Carolina, Greensboro, and my master's in public health also from the University of North Carolina, Greensboro. I've been doing public health work for the last 4 years, focused on diabetes, hypertension, recently asthma related to housing disparities, mostly in Guilford County prior to coming here to do work in Orange County. So I have a lot of background working with a lot of communities, specifically immigrant refugee communities, and also lower income communities in the rural and urban areas throughout the state.
So I'm Ceila Loughlin. I'm a pediatric pulmonologist, so children's lungs. I've been here at UNC since I started my fellowship in 2005. Prior to that, I lived in Baltimore, where I went to medical school and residency, and that was kind of the first place that I interacted saw the importance of housing in healthcare. Inner city Baltimore, there is parts that are really affluent and parts that are really struggling, and so, as part of a project there, went into homes in inner city Baltimore and saw how the situation that children were living in was affecting how they were able to get their medications, what tests and various things they were exposed to. And then also in residency, had the opportunity to work with the Indian Health Service. So I went out with the Apache Reservation and Navajo Reservation, and really saw there that you can't talk to patients in isolation without knowing, how are they cooking at home? Are they cooking on an open flame in a house? Well, that's really going to affect how a child breathes, if they're breathing in smoke, or what other accommodations these families have had to make to provide a safe and warm home that then affects whether their child gets pneumonia or has trouble with asthma. So then here I'm the director of our Allergy and Asthma Center, so I see the direct effect of that, and have partnered with both the local school systems. Frank Porter Graham, we've worked closely with the nurse there to have family asthma education nights to educate families about the environment and how to use their medications with asthma, and then also had the opportunity to work with the Orange County Health Department to develop a program, Healthy Homes, with one of our fellows. And so that was very exciting for me to be part of that and to help implement a way for us to provide interventions for patients and their families and give them opportunities to use a vacuum, to have the vacuum and things like that. So thank you for having me here tonight. I'm excited to talk about this.
Just a brief, I forgot to mention that we are recording this. And so I do think maybe we need to use the mics just in case. So all of you can share with your friends this wonderful event that you were part of. So I think there's just an on-off. Is that okay? Are we good?
Is everyone able to hear now? Yes. Okay, fantastic.
Thanks.
Okay, thank you, Jennifer. Well, building upon that, and Celia, if you wouldn't mind starting for us, perfect tee up to the next question is thinking about your experience within various different communities and populations throughout the country. What would you say the scale is in Orange County in terms of unstable or unhealthy housing at this point?
So I would say it affects almost all the patients that I see in one way or another. And just thinking about the hurricane barreling down on North Carolina as we speak, over the past couple of years, we've seen our families that are along the coast still haven't recovered from the flooding and then mold exposures. So things like that, just mold in the house, but then also issues with landlords not providing safe environments, of pest issues. Again, mold is a big one, but then cockroaches and rodents, which can also affect children with asthma. And that's specifically my passion, but it also, housing, I think when you have like a single parent family where that parent is trying to provide for a house, the electric bill, the medicines, then knowing that if the child is sick because of their house, then the parent misses work. And so there's lots of different ways. We've also seen it with food insecurity, of parents not being able, kind of having to decide, do I pay my electric bill or my rent, or do I get extra food for my child who has cystic fibrosis, or can we even afford to pick up the inhaler for the asthma exacerbation? So it affects people all over.
Thank you for helping us understand more of what's happening here locally. And Kirshnavenia, I believe as a part of your role, you actually do home visits. Similar to what Celia was saying, what are the health issues that you look for and have seen when you're going into homes specifically in Orange County?
Typically, when I go into a home visit, there are certain things that I look for. In my background, I'm also a certified inspector. So typically what I look for are like wet spots on the ceiling. Sometimes if a home has mold issues or moisture issues, you can usually smell it. Same if there is a pest issue or a vermin issue in the home, that usually is the telltale sign. And I also look for, I inspect the outside of the home, so any leaks that are on the outside, if there isn't proper drainage. So one of the homes that I actually looked at last year, it was a family of 5. It was a husband and wife that had just moved to the area back in Greensboro. And the home was beautiful, but the landlord had not been keeping up the property. So when they moved in, they didn't know that he had painted over all of the mold that was in the house. And so after about 2 weeks being there, the wall started turning the color of these chairs. And it was all happening in the bedroom. All the bookcases that they had in the house, the ceiling fan, it was covered in mold. And so everyone in the house was having allergies and breathing problems. That's typically usually what I ask the family as well. You're having any issues breathing? Has anybody in the home been to the hospital recently or had an ED visit related to asthma? And sometimes we see it in adults as well, which was the case that I saw last week. The mom had asthma issues, but she was pregnant, and she had a young child, and the home did have mold. And that's typically what we see. And one of the issues that I come across is that landlords aren't doing what they're supposed to do and not handling the situation properly. And so usually what I try to do is try to connect the family with some of the housing agencies in the area and some of our local partners to try to get them rehoused, because if they keep visiting the hospital and they're being prescribed medication to help their condition, it doesn't help when they
select a home that's continuously making them safe.
Would you mind giving a few examples of the local organizations that you would refer to in using that as a starter example? Who are some of the partner organizations that you work with to address those issues once they're identified?
So some of the actual organizations that I work with are actually a part of Orange County Affordable Housing Coalition, which Habitat is also a part of as well as the Health Department. Empowerment in Chapel Hill, we refer agencies to there. Also the Affordable Housing Community Development out of Orange County, which is next door to our office. We reference families there if they're looking for housing, if they need rental assistance. And some of the other local partners who do, if the family, for example, owns their home, but they're not able to make a repair, and due to the hurricane or a tornado, if the roof has damage to it, there are also some local partners like Rebuilding the Triangle, and some other organizations that help fund families to make repairs as well.
And Celia, would be interested in your perspective. Once you identify, and you give a few great compelling examples, I should say, of the impact of housing on health and the decisions that families and parents face. What are your next steps once you identify that that is the situation that your patient and their family is dealing with?
So luckily for us, a lot of the counties have mirrored what Orange County has done with their public health department and modeled healthy homes. So depending on the county that they're from, we try to hook them up with healthy home projects, which go into the home, identify environmental issues that may be triggering medical problems for the family, and then also educate the family on how to clean in inexpensive ways, which you can talk more about, and that don't have a lot of the fumes that some of these chemicals do have when you're cleaning, that can set off asthma exacerbations. So some of the counties were really lucky to have that, and then unfortunately the majority of the counties don't have that option, and so we try to work with our social work resources from the hospital to see if we can, if they're a Medicaid patient, Medicaid has caseworkers that you can contact to try to help the family. In our general pediatric and adolescent clinic, they've partnered with Orange County Legal Aid, so in situations where the landlord isn't keeping up their end of the providing a safe home, the legal aid workers come to the clinic and help give free legal advice to say, how can we make this situation right for the family? And a lot of times it just takes a letter from a lawyer, which unfortunately that's what it takes, but for them to say, oh, okay, well, we'll try to fix the problem. But unfortunately, sometimes the problem is just painted over in the next person. I had a family just last week who we're pretty sure it's a mold situation, and the landlord came in, ripped up the one area of carpet that was wet and moldy, and put some stuff down, put new carpet down, but didn't address like the air conditioning problem that was leading to the leak. And unfortunately, that family is not financially able to move right now to another housing situation. They just can't do it, and so I'm in contact with Medicaid right now, trying to get them to see, because so asthma is the most common childhood disease. It accounts for huge healthcare costs, both indirect and direct. Like the last numbers were over $13 billion in direct and indirect healthcare costs, and that has to do with parents missing work, kids ending up in the hospital. And so if you can kind of work with the insurance companies and Medicaid to say, hey, if we can fix this home situation, then this child is not going to keep coming to the emergency room. This mom isn't going to have to miss work every time this kid has to stay home. So it does benefit the insurance company and Medicaid to think about these things. And Medicaid has, in Wake and Johnson County, provides a healthy home option. So for the most part, it just takes a little bit of pushing and helping people to understand how the house is affecting the health of the child. And so in that child, I'm pretty sure that once we get him into a new housing situation, we'll be able to reduce the number of medications he's on and the number of times his mom is going to take him to the ER. So it's...
And with that in mind, and thinking of kind of raising this topic up to a broader scope, I believe there's a movement called moving the issue of healthcare upstream. So addressing the root cause versus what particular patient is presenting with when they come into your office visit or in your home visit. With that in mind, and this question is for both of you, so whoever would like to start first, thinking about both the investment as well as the research currently being done, and it can be in this community or nationally. I'd be interested to learn what is the work being done or the scope investment, both human hours, working to substantiate that this is in fact a problem, and the folks that are going out from the issue, as well as the dollars behind it. Would be interested to learn more if you could share with the group, please.
Yeah, so I don't know the exact numbers, but there's lots of people in the School of Public Health here at UNC who are looking at social determinants of health. I tried to look at that National Institute of Health for what grant money is available right now for social determinants of health. And I mean, there's lots of grant opportunities in thinking about this. And then just specifically in North Carolina, if you look at the North Carolina DHHS website, so Department of Health and Human Services, they've created this pretty cool map of North Carolina and dividing the counties up into regions where you can kind of look at the layers of social determinants of health and how each county plays out and where the pockets of housing issues are, education, poverty, and so there's a lot of really good resources there, and people like Dr. Betsy Tilson pushing this idea forward of we really need to think about all these factors that come into health, not just, okay, let me keep throwing steroids and inhalers at you, but what else is going on in the home, and so how do we fix that? Also on UNC's campus, we have the EPA building, and so there's partnerships with the Environmental Protective Agency of looking at environmental causes of how is that exacerbated, and right now, the big things, vaping and cigarette smoke, and how parents who thought they were doing a good job by stopping smoking and going to vaping, but now they're vaping in their house, and that's not a good choice either. So there's a lot of research going on about that as well.
And Kirshnavenia, based on your experience and your studies over the many degrees that you have, would be interested in learning more of your perspective of what you see and are reading in terms of the investment as well as the research being done on this topic.
So there's actually a few projects that are happening currently in North Carolina. I had the opportunity last year of being a part of what was known as the Build Health Challenge, which is a national program that funds projects across the U.S. focused on upstream health. And there were 2 project sites in North Carolina. One was in Charlotte that was focused on building new housing, and the other project was the one that I worked with in Greensboro that focused on rehabbing the home. So funding repairs that need to be made to the home, whether it was providing filters, providing mold remediation, lead remediation, and the key components for the project was that you had to have a health system, a nonprofit, and a community organization. And the health system that I worked with at the time was Cone Health. And so there was a project conducted called the Asthma Demonstration Project, where researchers at Cone and also some faculty at UNCG looked specifically at areas in Greensboro, specifically zip codes, where the majority of Medicaid patients were coming in for ED visits related to asthma. And they were all linked to one specific neighborhood that had a dilapidated apartment complex. And the money that was able to fund that project, we were able to get that apartment complex out of the hands of the former owner who had let it fall into disarray. And we were able to get it remodeled and work with the families to be able to get them not only rental assistance, but able to get them into other homes until the repairs have been made so that they were in a healthier, safer place.
Studies have been done in bigger cities, like as in Boston and Baltimore, DC, looking at just having an intervention in the home. So if you can reduce dust mite exposure, reduce mold, how does that affect asthma symptoms? And most of those studies showed up to a 50% improvement in asthma symptoms just by intervening in the home. So I think that's pretty powerful, especially in a bigger metropolitan area, that we could then see that that would work in the triangle as well.
And building upon that, specifically with asthma symptoms and the impact of the home and stable or unstable housing, I believe that one of the main reasons children miss school is asthma. So we'd like your perspective on what you see kind of in your day-to-day work in terms of examples and impact of how those two are connected, and any solutions that you might be currently working on or would like to see in our community.
So I can think of one specific family where it was a single mom who has triplets with asthma and allergies. So you can imagine challenges of having just one child with asthma and allergies, and she has 3, and she is on her own trying to work, and then they're now teenagers, so they're kind of protesting, taking their medicine all the time, and they were coming to us all the time, needing, so when asthma gets bad, you get a steroid burst, which then has side effects if you're getting that all the time, and then 2 of them were particularly bad, ending up in the hospital. And so when we started trying to investigate, we realized that she was struggling with getting the kids to do what they were supposed to do, but then it seemed more than that. So the 2 girls were particularly struggling, and we were able to get Medicaid caseworker to get into the house, and sure enough, in their room in the vents, there was mold coming directly into the house, and so they were in and out of the ER, in and out of the hospital, which was then causing their mom to miss work, miss income, and eventually lose her job. And so luckily we were able to kind of, through lots of help of the community, get them into a situation where they could repair that part of the house and then get the girls in a different part of the house. And subsequently that, with also just education in our clinic, every time they come, working with the teenagers, trying to figure out ways to help them understand why this is important. And all teenagers like to rebel against their parents, and unfortunately when you have a chronic illness, a lot of times they pick that as their choice of rebelling. And so we work very closely each visit. We have a certified asthma educator who works with the family and tries to identify where are things going wrong. And so we'll have a period of time where they're really well, and then all of a sudden they fall off on taking their medicine and things start to flare up. But I think the success story there for me was getting that bedroom cleaned up so that these girls had a healthy place to live, and then working with this mom to try to help her. And one of the interventions that Healthy Homes does is they come into the house and they actually see, are the medications that the physician prescribed actually in the home. So we've had situations like that where you're talking to the person who brings the child to clinic, thinking like this is the person who's giving the medicine and this is the person who we need to educate, when in fact the mom is working second shift, and so it's the grandmother who never comes to the visit that's actually giving the nighttime meds, and the kids are staying at her house, and the meds are at mom's house a lot of times. And so just working on, okay, which house are the kids at? And so that unstable housing of, okay, this is the best the mom can do to help her kids have a safe place to stay when she's at work at night, but the meds, and so kind of coming up with ways to make sure that the meds are where the kids are, and that the person who's home with the children actually knows how to give the inhaler and spacer and knows what to do when they're struggling. So I think there's lots of layers to instability in the home.
And thank you for just helping us kind of wrap a face and a family contextualize this issue, and really help ground, certainly learning a lot of how that impacts in so many different ways. Kirshnavenia would be interested in, just based on your experiences, both here and in your prior roles, as it relates to stable or unstable housing and education and health. Are there any other examples or bills that you would like to share in this regard?
Yes, one of the things that I would do, and I am planning on doing this fall, is making sure, like what you had mentioned, providing that extra support. So working closely with the doctors, that they're the ones that are prescribing the medication, but ultimately sometimes the family might just, here I'm going to take the prescription, and they go home. And when I go in, I find out that they're not able to either keep up with the medication, or they might, not decide to get it again because they can't afford to purchase it. I've seen cases like that, in addition to the home being in disrepair. So what I try to do is, sit down with the family and try to provide that extra support, that extra health education. And we also, in our program, we provide a green cleaning kit. So each visit, every family gets a green cleaning kit, which usually includes vinegar, peroxide, Castile soap. We also give a bucket, borax, cornmeal, and a spray bottle, and a few other items. And so basically the family can use it to clean up the home instead of using like harsh chemicals like bleach or anything that has like strong fumes that might trigger an asthma attack. But sometimes I go into a home and a green cleaning kit can't always address the issue. So it's almost a balancing act, because some homes, like the situation I mentioned earlier with the family being in the house with mold, we couldn't just call code enforcement because the house, in the condition that it was in, it could be condemned, and typically families only have 48 hours to get out. So it's balancing. For me, I feel like I'm always playing a balancing act and making sure that I work with the family to find them at least some place to go before the property gets condemned, because technically the city, by law, you have to condemn a property if it's in that condition. So it's always finding that balancing act, and also providing education to the family. Like, you can search a home that you might be considering renting. You can search and see if it's been condemned in the past or any of the issues. And so providing that extra information is important, so that families, if they want to rent a home or if they want to buy a home, they know what to look for if they see something that's suspect or anything structurally that might be not so sound. They'll know whether, oh, hey, this might be a good place that I can rent, or maybe we should look somewhere else.
And with this in mind, and all of the examples you've shared, and the fact base of the correlation and the triple effects that it has, or trickle down, I should say, and especially the introduction that Jennifer gave to us of the top issues that Americans consider important and crucial for our society. What are your ideas or recommendations in terms of how we can elevate as a community the importance of stable and affordable housing, especially today we're focused specifically on healthcare. What are some ways that our community can do that, and also as individuals that we can make a positive impact?
I think sessions like this, as Jennifer was saying, just getting all the people in the room to hear, so that we as the healthcare community aren't operating just in our silo, but even just sitting down and talking with Jennifer and hearing what Habitat for Humanity had to offer. I went back and started talking to our social workers and saying, gosh, there's all these other resources out there, and a lot of them they already knew about, but figuring out, like, getting the right people to start talking about this. And then I think this hurricane coming towards us, as it is big hype, I do think it helps, and maybe it's a good opportunity to put it out there that there's still people who aren't back in their homes from the hurricanes last season, and now this hurricane is coming. And I had families 2 weeks ago who there was still standing water in their land. They're in a trailer, and who knows, that hurricane is coming right back to where those people live. And so I think if we can just start getting the conversation out there about how all these pieces come together, I think that's going to be really important. And I mean, we've been talking a lot about asthma, but about other patients we take care of when the hurricane comes. We use power. We have children that are and adults who rely on have a tracheostomy tube and rely on a ventilator to keep them alive at home. And so if they have no power, we've been making plans now do those patients need to come to the hospital if they don't have a home. And then if you don't use an inhaler and spacer for your asthma, if you have a nebulizer that needs to be plugged in, like, how do you give your medicine if you can't even pay for electricity without a hurricane, and now a hurricane's coming, and how long will you be without that? So I think just talking about it and making people aware, and certainly at UNC we've started both with food insecurity and partnering with Orange County Health Department of saying, like, okay, we can't do this in isolation. There's other people out there, and trying not to work in parallel. I think when I took over the asthma program at UNC, the children's asthma program, what I kind of tried to do is go around, because there's people doing great research in the School of Public Health on asthma, and there's people at the nursing school and over at the APA building, but everybody's kind of working in parallel, and then starting to talk to the schools and the school nurses. Like Frank Porter Graham is a great example. The school nurse there is just so passionate about helping children with asthma and trying to keep them in school and not send them home every time they need to take albuterol. And And so trying to get everybody on the same page so that we're not all, that we can put our efforts together and not be, okay, the School of Public Health is doing this over here, but the School of Medicine is doing this. Like, we all need to, I keep joking, we need like a unified asthma action plan, but unfortunately in Healthy Homes we were talking about, because I wish there was just a statewide Healthy Homes, but unfortunately each county is having to take that initiative on themselves to say, we did the pilot program with Orange County and showed that it was cost effective to do this for the families of Orange County, but then slowly it's trickling around to the other counties of the state. So I don't know what other ideas you have.
Piggybacking off of what you had said, so we have 100 counties in North Carolina. Not every county has a Healthy Homes program. The one that I had worked with previously was actually through a nonprofit, because the health department's program actually lost funding over the last few years, so they were only focused on lead. So the nonprofit in the area that I worked for previously focused on asthma. One thing that I think is extremely important is, like what you mentioned, to have these type of conversations and to just educate folks, because people don't realize when you're at home, that's the place that you spend the majority of time of your day, unless you're at work or school. But it's where you go to sleep, it's where you eat. And so if it's not in the best condition, it doesn't matter how many medications you take. If you're in an environment that's not healthy, it can definitely make you sick, no matter how much prescriptions you are for the condition that you have. But I think what's also important is having these conversations, but also making sure that community members are at the table as well, because their input is very important. A lot of the work that I do focuses on community, and having community members at the table talk about what they're going through and what they actually need is extremely important. And despite all the cases that I've seen where it's been extremely terrible, housing situations and families going through a lot, communities come together and they're extremely resilient. And I think that's my main focus, especially in the work that I do, is always having a community voice at the table, because once you're able to find that one person in the community that you can trust, you can build on that. Projects that I've done in the past, the one that I did in Greensboro and some that I'm working on now, just like going to a neighborhood association meeting, finding out, about the local community and the different work that they do. And once people start to, build that trust and get to know you, they'll tell you, oh, hey, I know this person who's going through this. This person might have cystic fibrosis and they're having some issues with their home. And building that trust in the community is extremely important. And a lot of the projects that I mentioned earlier with funding, both on the local level and national level, have that community component, as well as looking at the social determinants of health factor.
Thank you very much to you both. I would like, speaking of community, to open it up to the audience for a few questions, unless Jennifer, you have any bills before them. Raise of hands if anyone has a question or would like to direct a question specifically to one of our panelists.
Yeah. I have a follow-up question to what you just said about bringing community together and engaging with the community. How are you doing that? Like, what are the forums, and how have you seen it be the most successful? Like, engaging the community, volunteers, what does that look like?
So I've, in the past and even currently, different communities that I've worked with, I think the main component is trust, because I've seen where universities or different coalitions and projects have had funding, and then they go into a community and they decide what they want to do, and the community's not, they're like, no, that's not what we need. We don't need a park. We need like affordable housing, or we need a community center, or we need certain things. So I think the way that, like, even when I first moved to Orange County, for example, I would just go in and sit on meetings, whether it was the local school, like the teacher meetings, or meeting with the school nurses. I would just sit and I wouldn't speak. I would just come as a guest and I would just listen and learn. And I would keep coming and just kind of build that friendship and learn about the different things that they're working on and building that trust. And once you build that trust, people will tell you, oh, hey, I'm dealing with this, or this person is dealing with this. What are some resources that you know of? And from there, building that relationship and that community partnership, from there it can branch off to some of the larger, because I have access to, be able to partner with different local organizations and universities. But what I don't have access to is, you know, the local church pastor or the person in the community that's known for being there for its community members. So building that relationship, I think, is extremely important because the money and the funding that we get can definitely benefit the communities who most need it.
So I'm just going to echo that. In Baltimore, the program that I was first exposed to before I started residency was a program where they actually engaged community health workers. So they found the people in the community. You know, Hopkins University is in a big, it's surrounded by a lot of low-income housing, and so the community there oftentimes doesn't trust Johns Hopkins because it feels like they're experimenting on them. They're doing research. They come and use the emergency room, but they don't want to be part of research studies. They don't want to, you know, they're very cautious and fearful of what the healthcare community is suggesting. And so the project there was for asthma, diabetes, and hypertension. So it wasn't just kids. And they went and found those point people in the community, whether it was the pastor or it was the grandmother down the street that everybody came to when their baby had a fever, and she was the one that was dishing out the health information, but engaged her to say, okay, you don't need, like, you can give Tylenol, you don't need to go straight to the ER with the first fever, depending on the age of the child, and really found those point people and educated them on, okay, this is when you need to worry for hypertension, and this is diabetes and asthma, and so that they were getting the word out and partnering with the community to say, here's the information, and can you help kind of get that information out there to the families. So that was really exciting to see and worked really well, helping so that people had better control of their high blood pressure, better control of their diabetes, less asthma visits to the emergency room. So I think finding those people in the community, and at UNC we're really focused on patient-centered care, so involving, so for us in pediatrics it's usually the parents who are involved in our committee meetings or on our teams. We bring them in and say, okay, we have this great idea for how things are going to work in clinic, where we're going to have a food pantry. You know, what do you guys think? And realizing, well, we appreciate that there's food there, but we don't want to be seen carrying out a bunch of food. Like, that's embarrassing to us to have to come to the hospital and get food. And so they worked with the family to say, okay, should it be a nondescript bag, and we can help you, or the respiratory therapist can carry it out to the car with you, so you're not carrying out a big bag of lots of food. But, so I think that also, as you said, like making sure that we have ideas of how it works, but make sure that the people that you're trying to help are actually involved in that care, and giving us ideas of ways to do it better, or saying, no, that's not actually the problem. The problem is that it costs too much to park at UNC, or whatever, you know, whatever. I'm late because I always have to valet my car, or whatever it is, and trying to help problem solve that way, I think is really important.
Thank you very much. Other questions?
Thank you so much for speaking tonight. I had a question about, so we've talked a lot about the physical environment of the housing where people are finding themselves in unhealthy situations, but what about the social environment that might be unhealthy in those housing situations, and have you seen examples of that in patients or people who've worked with in the community?
So one of the ideas we had talked about is certainly in pediatrics as well as adults, obesity is a huge public health issue, and having these areas of where you don't have access to healthy foods, but then also that the house there may not be a park down the street that the kids can go outside and be active in, or that the family doesn't feel like it's safe for them to be there, and so trying to problem solve ways of, okay, well, how can we get this kid active and out and doing some exercising, but then not also putting them at risk for other, violence in the community. And then, I think I talked a lot about the single parent is a big issue, and this kind of trying to, if you're lucky enough to have a grandparent around or an aunt and uncle that you can help with child care, but affordable child care is also a big issue, and safe and healthy, right? And so a lot of our kids with chronic respiratory problems, they go to daycare and they get a virus and they come home, and and so I think these are all things that it's really easy to breeze in and out of the room and not think about that and say, okay, you just need to take this medicine and it'll be better. And I think over the time that I've been in peds pulmonary, I think we've done a lot better job of involving our social work. And part of that has to do with the hospital funding it and not funding it. And so at one point we had a lot of social workers and we didn't have social workers. Now we're having social workers back in, but funding is a huge issue.
Yes, what I wanted to mention was lots of the issues that I see, like you had mentioned, obesity is one that I see with families, but many families, like you said, they debate whether should I pay the rent this month or like should I, buy cheaper food instead of healthier food, which cheaper food tends to be unhealthy food, or they might not have access. When I worked in some of the rural counties in North Carolina, sometimes a gas station is the only place that you can get like a banana or an apple because Walmart is 30 minutes away, and if there's no transit system and you don't have a car, it's very difficult to get healthy food. One of the things that and along with some of the other organizations that I've worked with to address food insecurity, for example, was working with one of the, back in Guilford County, one of the local community clinics, where when families visited the clinic, they would get a prescription for produce. And the prescription for produce would be up to a certain amount. And we partnered with Guilford College, who provided their food truck, which basically had fruits and vegetables that have been grown on campus. And so families were able to use the prescription for produce. You don't have to pay anything to be able to get fresh fruit. And that would happen once a week through March all the way through October. So families were able to get fresh fruits and vegetables. So that's just one way, and funding from a grant went towards that. So just think of different innovative ideas. And also it was a mobile unit, so it could go throughout the community, where families didn't have to drive all the way to campus to get fresh fruits and vegetables. So just thinking of different innovative ideas to be able to address some of the issues that we come across in our work.
Thank you. And we have another question back here.
Hi, and thank you for the information that you're giving. But my question goes back to the landlords, because it don't seem like nothing is being done to these landlords. If there are legislations, laws that is coming against landlords that are allowing these violations and unsafe homes, and how are they enforced?
So what I have been working in housing for the last few years, one of the things, and I asked that same question because I would go into homes and I'm like, how is this allowed where this house is like covered in pests and the person that's staying here is an elderly person who's an amputee and the landlord's not doing anything, but she's paying her rent on time and they're not addressing the issues. And a lot of it has to do with the laws that have happened over the past few years where we, at least from what I've been told from other inspectors and other government officials as well, is that a lot of laws that were written or there were loopholes that were written in were by individuals who were politicians but also owned properties. And so it kind of made it easier because they were also landlords, because there were stricter rules previously. Within the last 10 years there were stricter rules, so this is something that's fairly recent. But that's one of the reasons why we do partner as well, as you mentioned, you all do with legal aid. Because I've seen, like the home that I mentioned, there was a woman that I worked with, she was in her 70s, she was an amputee, and she was living in a home that had been damaged by the tornado that hit Greensboro last year. And the home was infested with roaches and had electrical issues. It was not handicap accessible at all. And we were able to get her into a new home, new furniture, and got her into a healthy situation. But the landlord went right away and took the condemnation sign off the house and tried to rent it out to someone else until we were out in the community and we told the person who was interested, even though technically as a housing, working for housing, I'm not supposed to say anything, but I was off the clock. And so I mentioned to her, I was like, you don't want to rent from there because the house is condemned. But it's something unfortunate that I come across a lot, and just working with families, and usually the county and the city, they're aware of certain landlords. And so we can work with legal aid to be able to get the family their security deposit back. And some of the local organizations can also get rental assistance and other assistance that they might need to be able to get rehoused.
So I see 3 more questions.
Thank you. Building off of that, what are some kind of state and local policy changes that you think could be an effective means of addressing the issue? And then a related question, so if you could speak to kind of what degree UNC as a health system is engaging in policy advocacy, and if you'd like to see that increase and what it might take that to increase.
One thing that I'm seeing in terms of policy development on housing is that the state of North Carolina is looking more at the social determinants of health, especially in regards to housing. And so just having conversations like this, and even at the state level, and having these type of discussions about housing and how it is important, and how these laws and these loopholes can cause families to live in situations that they shouldn't have to. One of the policy developments that I'm working with now is the North Carolina Institute of Medicine, and they're currently in the process of writing their Healthy 2030 report. And so it was interesting because one of the meetings that I went to, housing was on the list, but it was on close to the bottom. Yeah, it was like way on this, and I kept like advocating. It was like, no, we have to, these other issues are important, but they all connect. All of them are connecting, and so we were able to include housing on the list as a priority for the state's funding for the next 10 years. But it takes, conversation and people knowing about it. And I think it is moving, but the clock is just moving a little slower than it is on other issues. But just having the discussion, talking to your family, talking to your friends, social media. But I do think that the state is seeing that this is something that is important, especially with Medicaid transformation that's happening in 2020.
And as I can speak to like the PEDS residency program, all of the pediatric residents are required to do an advocacy project, and so that may range from child abuse to lead poisoning, housing, or getting involved in, like a resident helped me develop the Family Asthma Education Night at Frank Porter Graham, and we got some funding for that initially, and so I think it is a push for all physicians to have that. We get pulled in a lot of different directions, and so there are people that is part of what they do regularly each month is go to advocate for the priorities for healthcare. So I think if we can get this out there, just even talking at our department level about, after I met with Jennifer, and the idea of thinking of housing as a vaccine, I thought that was a great idea, although anti-vaxxers might, but no, I can say that in Chapel Hill, Scarborough, but just this idea of, in pediatrics, and that's one of the reasons I went into pediatrics, is this opportunity to be preventive, right, and to think, okay, what can we do now as a child that if you're already obese and have high blood pressure and diabetes as a 60-year-old, I mean, there's still things you can do, but obviously when you're 4 and 5, and we can talk about healthy eating and work with families for healthy homes. There's a lot of opportunity there to say, how can we prevent all of the further, outcomes that are further down if we don't provide safe, affordable housing. And I think that also factors into the healthcare discussion of cost going to healthcare dollars. Like, you can put all this money into healthcare, but if we're not taking care of some of these other issues, it's the United States spends lots of money on healthcare, right? Our outcomes are not very good compared to other countries. So I think it just has people like all of you and us to keep bringing it up and say, okay, you can't keep spending hundreds and billions of dollars on healthcare and not look at these underlying issues and viewing healthcare as a housing as a right, not a privilege. A safe house should be provided for everybody.
Thank you so much. And just with respect to everyone's time, we'll cover these last 2 questions, but we also will have a few minutes afterwards to mingle, and the panelists will be staying as well, so feel free to approach any of us, as well as Jennifer at the end. So we'll cover these 2 questions and move to close.
Just in terms of affordable housing, obviously that's discussions here, and you both have mentioned that there has been significant need for an affordable housing option for certain patients that you've seen or homes that you've been in. How accessible is that to you? Do you feel like there's a need for more? I mean, I guess what's the conversation? We've talked a lot about like the conversation around healthcare and affordable housing, but is it available? Is it readily available for the patients who need it?
Not in Orange County, no. One thing that it was a huge transition for me is that when I was working in Guilford County, the issue was that there was a lot of housing, but it was not in that great shape. Like it needed to be torn down and new housing needed to be built. Whereas in Orange County, Orange is pretty rural, aside from Chapel Hill and Carborough. And so the issue is that the housing that is available is too expensive. The living wage in Orange County, you have to make at least $15 an hour in order to be able to live in this county. That's not minimum wage for many folks who are working minimum wage. And so the issue that we see is that families, instead of living here, they just leave. They leave and move to Chatham or Durham or Alamance, or they go further west or east. And so what we've been working on with the Orange County Affordable Housing Coalition is coming up with innovative ideas on how we can address affordable housing in Orange County and in Chapel Hill and Carborough. And the partners that we have are from the cities in Orange County and also Orange County representatives as well, individuals from UNC, thinking of different, and community members as well, thinking of different innovative ideas on how we can work to build affordable housing so that families can be able to stay in the county because, like what you mentioned, the issue is that there's lack of availability of housing in Orange County and also lack of affordability for the housing that currently exists here.
First off, thank you both for being here and for being on the front lines on this. I mean, this is a very complicated problem, and just running it through my head, you're probably crossing at least a dozen plus agencies you're dealing with. There is multiple resources to draw from, and there's multiple layers of problems to the symptoms the government is throwing money at to fix the symptoms and not the problem. So is there an initiative or effort to help coordinate some of the things cross-agency to provide either provide insight or light on the resources that are available? And is there an initiative to also provide more information around the systemic cause of the problem and bring that to light so we can get funding around this?
So there's currently a project that's been started in a few of the counties throughout North Carolina. Orange will be in the second roundup, but has anyone in here heard of NC Care 360? So it's a resource platform that's being funded by United Way, Foundations for Health Innovations, which is outside of Cary, and NC 211. And so it's privately funded, it's not funded by the state. And it focuses on being a statewide resource platform where housing agencies, clinics, homeless agencies, all of the different agencies that address food insecurity, will they'll be a part of one network. And so if you have a family in Asheville, for example, that might need housing, the agency can go on the website, pull up housing either in Asheville, or if they're looking for housing out this way, pull up an agency that might be able to refer them to housing here. And so the purpose is to be able to build a better network for all the agencies that focus on these different complex and interconnecting levels, so that we can be better aligned instead of working in silos, and instead of doing that, working closer together. But that's one of the efforts that I've been seeing recently, and Orange and Wake County are going to be a part of the next wave of counties that are going to be starting up, participating in NC Care 360.
And there are links to both of those on the North Carolina DHHS website, so you can get there. 211 was a new one, because I think they can also provide like mental health services, and so it's kind of a go-to for anything that a family might need. And so when we're limited on social work staff, or in our Raleigh clinic location, that has been a really great resource to try to say, okay, this family has a loss in the family and they're grieving, how can we help them? We're the mental health grief counselors in their county, and that 211 has been helpful for that and housing. And so, yeah, I would look to the DHHS website. There's lots of really good information there.
Excellent, thank you both.
Thank you. Yes, one more round of applause for our panelists and for our fantastic moderators. I just have to say I was I'm part of a steering committee in Chapel Hill through the chamber that's working on what are the big, bold ideas that we need to address in our community. And then this morning I was at another chamber event that hosted candidates for local elected positions in Orange County. And affordable housing does come up, I think, more locally than it does on the national stage. So you're sort of sometimes hard pressed to hear a national candidate talk about housing from the debate stage. It doesn't get talked about. We talk a lot about healthcare and the cost of healthcare, but not as much around housing. But locally, I think the questions around policy are really important. And so today I was at this conversation and we kept coming around to the local school system and the achievement gap. And if I'm looking at the local school system and the achievement gap, and we talk about equity, if you have a group of students and the number one reason they're missing school is related to asthma, and that feels like something that is relatively preventable, why are we not making that connection? We're creating policies and initiatives to work on the achievement gap. And again, we talk about if you're moving homes frequently because you can't afford the home, or if you're living in a home that's making you sick, that needs to be a part of this conversation around the achievement gap. And again, I was just at this conversation this morning, and that's not part of what we're talking about. And there are other initiatives that obviously that's not the whole solution, but I think it's a part of the puzzle. And so as we leave and we think about awareness, and every one of you knows someone, and every one of you will be in another room where housing is at the bottom of the list or is number 9th on the list, and we're talking about all of these other very important initiatives, then you can be one of the advocates that helps us raise the level of awareness on the importance of housing, not just because we want people to have a safe, decent house and that should be a right, but also because of all of these other outcomes and the cost that it costs not only individuals but our community as well. I do have to pitch that Habitat International has a new national advocacy campaign called The Cost of Home. We have some information here. We're happy to email you about it. It has a number of different policy platforms that'll be happening, that we'll be adopting some locally and also nationally. The reason the Cost of Home campaign was started was, again, around this idea of the cost and how much it costs. The statistic that they're using in the campaign is that 19 million people in the U.S. spend more than half of their income on housing. And so if you're spending more than half of your income on housing, then you're really forced to make some tough choices around healthcare costs. Am I going to fill the prescription? Am I going to buy the bag of apples? Am I going to buy the box of, ramen or whatever, the pastaroni or whatever it is, the 99-cent meal on the shelf that I can afford so that I can pay my rent. So if you're interested in that, I'm going to say Alice Jacoby here from our Habitat staff is our liaison to Habitat International and the Cost of Home campaign. We want to keep the conversation going, so you have information around the next 2 panel discussions on education, where this probably will come up again as we talk about housing and education, and then the last one on economic mobility. So we hope to see you again. Thanks again to our panelists, our moderator, the Keenan Flagler students who helped put it together, and we'll stick around and have some more conversation as we think we have the room until 8. So thanks again for